Hi, my name is Folkert, and I am a licensed and certified athletic trainer in the state of Florida and currently continuing education at the University of Florida. Within this video, I will be demonstrating the VOMS test, or vestibular ocular motor screen, which we clinically use to assess athletes after concussion. The VOMS consists of 5 tests, including smooth pursuit, saccades, both horizontal and vertical, convergence, vestibular ocular reflex, or VOR assessment, both horizontal and vertical, and visual motion sensitivity testing. As we go through each of the tests, you'll notice that I am asking the patient for his symptom scores for headache, dizziness, nausea, and fogginess. This is done after every single one of the tests, not just at the end of the entire exam. Clinically, we will use these symptom scores to determine the route of clinical intervention to help the athlete to recover from their concussion as safely and quickly as possible. So before beginning the VOMS assessment, you want to get a baseline of how the patient is feeling right now. So we have a chart here with all the symptoms that we're going to be testing and requesting him to rate after every one of the tests. And so we're just going to get his baseline right now. So what would you rate from 0 to 10, 0 being not at all, 10 being really, really bad headache?
2.
Dizziness?
0.
Nausea?
0.
Fogginess?
0.
Okay. So the first one of the VOMS exams is smooth pursuit. So this tests the ability for him to follow a slow moving target. The target in this case is going to just be my finger. And so I'm going to hold my finger about 3 feet away from the patient and perform 2 reps horizontally and 2 reps vertically. Okay. How do you feel after that? Is that okay?
Mm-hmm.
How would you rate your headache?
2.
Dizzy?
1.
Nausea?
0.
Fogginess?
0.
So moving on to the convergence test, this measures the ability of the patient to view in your target without double vision. So for our target, this time I have an expo marker with an X that's about 14 size font written on it. So I'm going to give this to the patient, and for the test, he's going to hold it out about arm's length and bring it in. And so if you see 2 X's fairly clearly, that's when you're going to stop, okay?
2.
Okay. So in this case, the marker touches nose, so that would be a measurement of 0 centimeters, but we also have a measuring tape here, say you were 2, 3, 4 centimeters away from the tip of the nose. An abnormal near point of convergence is if it is over 6 centimeters from the tip of the nose to the target X. This is going to be measured 3 times, and then we will record all the findings. So that first one was 0, you're going to do it 2 more times. That's also 0. And then it's important to note as well that, say he were 2 centimeters away, and I noticed that there was some deviation of one eye, then that would be where he would stop as well. But in this case, I did not see any deviation. And then you're going to go 1 more time. And then once again, we're going to get some ratings of his symptoms. Headache?
2.
Dizziness?
1.
Nausea?
No.
Fogginess?
No.
Okay. Moving along to the vestibular ocular reflex, or VOR test. This assesses the ability to stabilize vision as the head is moving. So once again, our target is going to be this green marker, and it has the 14-point font X on it. The goal of the patient is to be continuously looking at the target while his head is moving. We have a metronome set to 180 beats per minute. And that will be the rate at which he attempts to move the head. And so once again, we're going to be going 10 reps. So right and left will be 1. I'm going to hold the marker out. You're going to keep your eyes on it, and you're just going to move your head right and left, okay? Good. So what would you rate your headache?
2.
Dizziness?
2.
Nausea?
0.
Fogginess?
0.
So vertical VOR test, all the other factors remain the same, just that he's going to be nodding yes and no, or nodding yes instead of shaking no. So you're going to be looking at the marker again and just nodding up and down. It's still 10 reps, okay?
Yep.
Symptom score once again. Headache?
2.
Dizziness?
2.
Nausea?
No.
Fogginess?
No.
So our last test is the visual motion sensitivity test, or the VMS. This tests visual motion sensitivity and the ability to inhibit vestibular-induced eye movements using vision. So with this, the entire patient's body is going to be moving. So we're going to have to stand up. I'm going to show you what you're going to be doing first before we actually do the test. So you're going to stand with your arms out in front of you, and this time the target is going to be your thumbs. You're going to turn 80 degrees to the right and 80 degrees to the left. This is going to count as 1 repetition. We're going to do a total of 5. I'm going to play the metronome. It's going to be a lot slower than the last time with 180. It is now going to be 50 beats, and you're just going to do a total of 5 reps. Okay? And then our last symptom check. How would you rate your headache?
3.
Dizziness?
4.
Nausea? Abnormal findings or exacerbation of symptoms with any of these tests may indicate dysfunction. This should trigger a referral to the appropriate healthcare professional for a more detailed assessment and management.